internet, that tedious, how do I get my insurance from the government? Doesn't have to. You can refer them to Craig Cushingham. He will cut through all the chase and get them the right insurance, the right price every time. Also, he's not in it for the money. No, he's really, truly a people person. He lives by the heart of keeping food on the table, but keeping people healthy. So let me introduce him.
I wasn't here last week because I was down in Florida. And this is the 24th time I've coordinated a 10-day Bible conference for my church down in North Florida. So we started in 1991 and just finished, had several hundred people, and some from Europe came over too. So yes, that was it's a terrific time. But here I'm going to talk about Affordable Care Act, and please look at the handout that says income level for federal subsidy. And I'm going to pass out little mini versions that you can stick in your planner. Because what this is the big question is, how much is it going to cost? And is my doctor in network? And nobody knows the answer to these things. So what this does, I'm giving you a chart. And it says that this is for income level, and this is modified adjusted gross income. So John, you would be glad to know that I got the actual, what that means. They're on that first line. So we have 1, 2, 3, 4, 5 columns of income. And quickly, if they run between column 1 and column 2, they're screwed because they don't qualify for Medicaid and they don't qualify for a federal subsidy in Georgia. So I'm looking for people that earn, an individual earns over $16,000 and he earns less than $46,000. That person will get a subsidy from the government. It's a sliding scale. If they earn less, the government pays more. They pay a little bit of the difference. If they earn more on that scale, then they get less of a subsidy. If they earn more than $46,680, they're going to pay the entire cost of their health insurance without a federal subsidy. However, the good news is they don't have to spend an hour and a half on the internet applying for the federal subsidy. They can call, I can send them a link, and 5 minutes later they have their health insurance for 2015. So, the other important thing is that, see, 1, 2, 3, 4, the fourth column, where it says cost sharing reduction subsidy, 250% of federal poverty limit. If they earn less than that on their household income, then if they get a silver plan, which has a high deductible, the deductible for a family is $8,500. It reduces down to $1,800. The deductible is reduced. It looks just like one of the more expensive plans, but it costs them so much less. It's only available on that one type of plan, and I can tell them about that. So, if they want to know exactly what their federal subsidy is, have them call me and I can do an estimate. It takes me about 25 seconds to figure out that estimate for them. So I often ask them, the big question is, what do you guess your income is going to be for 2015? Give me your best guess. And then I look on here and see if they fall under any of these categories. And I can tell them the good news, the better news, or the awful news. Now, if they are applying, you're going to run across people which are applying already on the internet. That's fine. On the very bottom, if they are applying on healthcare.gov, there's a question that says, are you asking with an agent? Are you working with an agent? If they put in these 2 bits of information on the bottom, then they assign their policy to me, which gives me the option to then answer their questions and follow through on their claims for the entire year of 2015. If they don't put that in, then I call up the insurance company and say, who are you? And I can't help them. So it costs them nothing else to have me, nothing at all. So how this goes is that we've handled how much it may cost, and generally it's going to cost more, and it could be a lot more than what they're paying now, but I have options. The second thing is that people don't know is they go on to healthcare.gov, they take the less expensive one, which is going to be Coventry, and they call their doctor a month later and they go, we don't take that. I go, oh, you don't take it? They call their next caller, we don't take that one either. So I'm very concerned about who their doctors are because I have all the networks. I then can check to make sure that their doctors are actually going to be paid by the insurance companies rather than being denied. And then I can point them in the right direction. Generally, we're looking at, for Cobb Insurance, we're looking at Humana. But Humana has two different networks. They have the HMO-X. I was talking with one of my referrals last night, and they said, well, we want the Platinum, the most expensive. And we're going to go with the Atlanta HMO. And I said, you live in Cobb County. Your doctors, there are no doctors in Cobb County which are on that list. They're all down in downtown Atlanta. Do you want to drive 25 miles to see your doctor? A different doctor. So I said, if you spend $15 a month more, you'll have the national network with Humana that has all of the doctors in Cobb County, and it's national across the U.S. So if you're traveling, you're in network. For $15 a month, she was saved all the aggravation. Mary Madison will tell you that she had the other network for a few months last year, and it was difficult. But if they call me, I can check on pricing, I can check on network, and I can help them before December 15th. If they wait, they can apply all the way up to February 15th. You have to apply by the 15th of the month to start the first of the following month. So they start on February 15th, they apply, it starts March 1. But if they want something in between, they were out of luck. So time is of the essence now to have your friends and neighbors give me a call so that I can get them into the right policy for 2015. This little one you can hand to them. The big one, I have more of them. You can actually read it. So I'm very happy to offer options for health insurance for individuals and families, those that qualify for the subsidy, those that don't. Any questions? I'm Craig Cushingham.